Hi, everyone. My name is Joanna Tenkate, and I work at Global Heart Hub as their Patient Community Engagement and Development Lead. And I am really excited to be here today and excited to see so many people joining as I get started here. So, for anyone who may not know, Global Heart Hub is an alliance of heart patient organizations and advocates aiming to create a unified global voice for those living with or affected by heart disease. So, this is part of Global Heart Hub's Empower webinar series, where we partner with patient organizations around the world to respond to the questions and needs of patients. And in line with this year's Heart Valve Disease Awareness Week, Global Heart Hub and Heart Valve Voice Canada are jointly hosting this webinar in support of the shared commitment to reaching and empowering the global patient community and in creating a collective voice. So I want to welcome everyone to today's session, where we will be talking about shared decision-making for patients living with heart valve disease. So we can explore what that means for patients looking to engage in healthcare decision-making. So heart valve disease, very quickly, is a medical condition that occurs when one or more of the four valves in our heart doesn't work properly. It is common, serious, but treatable. In fact, a simple stethoscope check is the first step to detecting heart valve disease. And that's what we're going to get more into today, heart valve disease and how patients can engage in shared decision-making when they go into their healthcare journey. So just as a bit of housekeeping before we get started, I want to call attention to the fact that this session has live audio translations into French. If you would like to hear this session in French, select the translation room. Automated translated captions are also available in the caption button. I also want to make a note that this webinar is being recorded and will be made available online after the event. And with that, I'm excited to introduce our speakers who will be covering this important issue. We will first be hearing from Ellen Ross, who is the Managing Director of Heart Valve Voice Canada, and Dr. Christina Lewis, who is a researcher with the University of Ottawa, who will be presenting on the concept and importance of shared decision-making. We will then get into discussion with two clinicians, Dr. Talal Alatassi, cardiac surgeon, and Cindy Wheeler, a nurse practitioner, to talk about the practical application of shared decision-making from a clinician's perspective. We are then very grateful to have with us two patient advocates, Bill Power and Cole Morrow, to share their personal stories and offer valuable tips for how patients can collaborate with their clinicians. So to get us started, I'll now be handing it over to Ellen and Christina for their presentation. So Ellen and Christina, please take it away.
Thanks, Joanna. It's so nice to be here today, and I welcome everyone to this webinar. We're thrilled to have you dive into this topic that's crucial for anyone that's navigating heart valve disease. If we could grab the slides, that would be great. Second slide. Super. So whether you're newly diagnosed or have been managing your condition for some time, making decisions about your treatment can really feel overwhelming. And that's why understanding what shared decision-making is and how it can empower you in your journey is so important. So shared decision-making is a collaborative process that puts you, the patient, at the center of your healthcare journey. It's about working together with your healthcare team, which is your doctors, nurses, and other specialists, to make a decision that is right for you. In this process, your medical team will provide you with all the necessary information about your condition, the various treatment options, and the potential risks and benefits of each of those choices. But it doesn't stop there. They also take the time to understand your personal situation, your preferences, values, and lifestyle. So it's together that you discuss the options, weigh the pros and cons, and consider what matters most to you. Next slide, please. So to fully understand what shared decision-making is, it's really important to clarify what it is not. So shared decision-making is not about presenting risks and benefits for only one option, which leaves little room for true choice. It's also not about listing a set of options only for the clinician to recommend a specific one without meaningful input from you, the patient. It's not a process where you're handed a menu of choices with the expectation that you'll pick one without any guidance from your healthcare team. Nor is it simply about obtaining informed consent for a single treatment, which is often more about legal formalities than real engagement. And lastly, while patient education is a key component of shared decision-making, it goes beyond just educating you about your condition. It's really about actively involving you in the decisions that are going to affect your life and health. Next slide, please. So shared decision-making is particularly important for people with heart valve disease because you are often faced with very complex treatment options, each with their own risks and benefits. And these decisions aren't just medical, they're deeply personal, affecting how you live your life every day. For instance, some treatments might offer a quicker recovery, while others provide longer-term benefits, but require more invasive procedures. So understanding all of these nuances allows you, the patient, to choose a path that best fits your needs and preferences. And so with that, I'm going to turn it over to Christina to talk about the research around shared decision-making.
Thank you so much, Ellen, and welcome everyone. And so taking together, there is a large body of research that has shown benefits for patients when healthcare providers and patients engage in shared decision-making. Patients who are engaged in decision-making report less concerns about their illness, less fatigue, and less depressive traits. And they also report an improved quality of life, sense of control over their illness, and better symptom control and relief. Improvements have also been noted in the healthcare experiences. And so involved patients report better communication with their healthcare team, greater involvement, and overall satisfaction with their care. In a review of 39 studies on shared decision-making led by Shea and Lafata from the University of Texas in the United States, they reveal that when patients perceive that shared decision-making has occurred, effective cognitive outcomes improve. And so what this means, in other words, is that these patients have better knowledge about their condition and the options that they're facing. They experience greater satisfaction and are more sure about the best choice for them. Next slide, please. Oh, next slide, please. Sorry about that. So Natalie Joseph Williams at Cardiff University in the United Kingdom led a review of 44 studies that looked at patients' perspectives on what obstacles are in the way for patients to participate in shared decision-making. And so patients reported that their individual capacity to participate in shared decision-making was hindered primarily by barriers at two main levels. So one of the barriers that are related to how the healthcare system is organized, which is represented by the outer circle on this slide, due to barriers such as time or lack of continuity of care and the setting in which the decisions are being made. And they also reported barriers at the level of the interaction between them and their doctor, where and when decision-making happens, which is represented by that middle ring. But what was most importantly revealed in this review is that patients reported that they lacked knowledge about the disease, about the treatment options, the outcomes of those treatment options, and how to communicate what is most important to them. And yet they also felt that they lacked power. They perceived a power imbalance in the doctor-patient relationship. And so patients need both knowledge and power to achieve their individual capacity to participate in shared decision-making. So each alone was found to be insufficient. So who can help? Well, again, from this review, from the patient's perspectives, nurses play an important role. Patients reported that nurses can enhance shared decision-making by taking time to explain information, provide support by actively listening to patients' preferences, and advocating for their patients by informing the doctors and the heart teams about those preferences. Next slide, please. So at its core, shared decision-making is a conversation between healthcare providers and patients, both of whom bring their own expertise into that discussion. But we recognize that sometimes it can be difficult to navigate these conversations. And so there are tools and there are resources that can help patients obtain that knowledge and feel empowered to help facilitate shared decision-making in practice. Next slide, please. So patient decision aids are one of these tools. Patient decision aids are evidence-based tools that are intended to support patients who are facing a specific health decision. And they differ from standard patient education materials in that they're explicit that there's a decision to be made. They provide facts about the options that are available, the risks and the benefits of each one of those options, and they're all presented in a balanced way based on what is known from the most current and the highest quality research that's available on the topic. Patient decision aids are also designed to clarify values, getting patients to think about and communicate what is most important to them and how those preferences align with those available options. And finally, patient decision aids support the decision-making process. They guide people in a stepwise manner of weighing their options and helping people to participate meaningfully to the degree that they wish to in the decision-making process. Patient decision aids can come in various forms. They can come in print, in videos, or web-based, and can be used ahead of a consultation with a doctor in preparation for that consultation, or can be used during a consultation. Next slide, please. So Dawn Stacey at the University of Ottawa in Canada leads a large review of randomized controlled trials of patient decision aids on a variety of screening and treatment options. And the most recent update that was published just earlier this year included 209 randomized controlled trials and showed that patients who are exposed to a decision aid compared to usual care practices make better quality decisions, which is represented by having higher knowledge, better perceptions of risk, and better match between the choices that they make and what's most important to them. Patients who are exposed to patient decision aids also report better decision-making process. So they experience less uncertainty about the best course of action for them, and they help patients be more active in decisions. And importantly, there are no associated harms with their use. Next slide, please. So an example of a patient decision aid in the context of heart valve disease is one that was recently developed by Ontario Health in Canada in collaboration with patients and caregiver partners, clinicians, and researchers. And this decision aid is intended to be a resource to help patients, their families, and their healthcare team make good decisions together about how best to treat aortic stenosis, which provides tailored information on the risks and benefits of each one of the options based on that person's surgical risk, whether low, intermediate, or high. And the treatment options that are presented in this decision aid include surgical aortic valve replacement, or SAVR, transcatheter aortic valve implantation, also known as TAVI, and also medical management. And so not to fix the valve, but rather continue with medical management and medicines. And so at present, this decision aid is currently being piloted in a few regional cardiac hospitals to gather some information and some lesson learned about how to best integrate it into the clinical workflow. Next slide, please. There is a freely available repository of patient decision aids that meet international quality standards on a wide variety of health decisions in the cardiac context and beyond. And so on this slide is a screenshot of this A to Z inventory housed by the Patient Decision Aid Research Group at the Ottawa Hospital Research Institute in Ottawa, in Canada. And so if you were interested in searching for heart valve disease patient decision aids, 2 are housed on this inventory on aortic valve disease, including one from the University Hospital of North Norway and from the American College of Cardiology. Next slide, please. In the absence of decision aids, the Ask 3 Questions prompt is a quick and nimble strategy to encourage and empower people to be involved in their care and decisions about their health and to generate discussion. And so these questions are, 1, what are my options? 2, what are the benefits and harms of those options? And 3, how likely are each of those benefits and harms to happen to me? And so research has shown that when these 3 questions are used in clinical encounters, patients ask more questions, patients feel more empowered to ask questions, and healthcare providers offer more information and often higher quality information in response to them. Next slide, please. So finding the courage and the words to share your expertise as a person with lived experience of health and illness with your doctor can be tricky at times. And the main benefit of letting your doctor know what is most important to you is so that decisions can be made that best meet your needs. And I acknowledge that it can be tricky to share sometimes, particularly when emotions take over or when feeling pressed for time in that consultation, or when we feel like we can't find the right words. And so using the sentences on this slide may be a good place to start thinking about what may be your goals. For example, I would like to be able to return to work. I am hoping to attend my child or my grandchild's wedding. I would like to avoid starting new medications. And so sharing your responses to questions, what are my concerns? What matters most to me? What brings me joy? Are also good ways to reflect on and communicate what is most important to you. And sharing your expertise as a whole person that's impacted by heart valve disease. So Ellen, I'd like to hand it over to you again, and we can switch the slide. Thank you.
Great. Thanks, Christina. And Christina highlighted a number of great resources, and I just wanted to acknowledge a few others. The Global Heart Hub developed a shared decision-making guide and a checklist, and they speak to the concept of shared decision-making, but also provide questions that you might want to ask your healthcare team. So that's available on the Global Heart Hub website. You can also find it on the Heart Valve Voice Canada website at heartvalvevoice.ca. Just wanted to acknowledge there is all sorts of patient education information on our website, including information about various valve conditions and treatment options, resources, as well as a number of patient stories. And we hope all of those resources will help support you in your journey with valve disease. So on that note, I would love to hand it over to members of the heart team who will really provide their perspective on shared decision making.
Well, thank you so much for that, both Ellen and Christina. That was such a great presentation on shared decision making and what that might mean for patients, and also how it can help patients. And I think that's really what it's about, is how it helps their health outcomes and understanding their health journey. So I'm now really excited to turn to Talal and Cindy so we can hear more about shared decision making from the perspective of healthcare practitioners. So Cindy, if I could start with you, could you please introduce yourself and tell us why you wanted to speak on this topic?
Thank you for allowing me to participate today. So just to give a little bit of background on my journey, I started as a bedside nurse in the 1990s. And as a young nurse, I quickly realized that increasing my own medical knowledge and expertise was imperative to supporting patient care and my practice. So after 15 years and a lot of education, I became a nurse practitioner through graduate education. And since 2012, I've been a nurse practitioner in nephrology and diabetes. And then in 2018, I was able to join the TAVI team here at Sunnybrook. And when I joined this team, our model is that the nurse practitioners, now there are two of us, who are advanced educated nurses with education, skills, and experience to prescribe medications, order diagnostic tests and review those results, and diagnose clinical conditions for each patient. We manage the patients from the time they're referred into the clinic, help to support them when they're first seen within the clinic, to inform and guide on their diagnosis, guide in their managing their symptoms, and to review their treatment options. Then we see them once their testing is done to be able to inform them whether they're a candidate for either surgery or whether to have percutaneous approach by having TAVI, or for medical management, and it's a discussion with the patient. What this does is, because the nurse practitioners and the fellows join us in the clinic, it allows the time for the interventional cardiologist and the surgeons to be able to do the procedures. So our team model works really well for patient care. And during this discussion, when I'm with patients, I ensure that each patient has the opportunity to voice what quality of life means to them the impact of the possible complications versus likely improvement in their symptoms if they have their aortic valve replaced.
Thank you for the introduction, Cindy. I think that gives us a good snapshot into what it means for a practitioner like yourself as a nurse practitioner, and what it looks like to engage in shared decision making. Now, Talal, if I could ask you to introduce yourself and tell us why you wanted to talk about this today.
Yes, thank you, Joanna. Good morning, good afternoon, and good evening, I guess, wherever you are. Thanks to Global Heart Hub and Heart Valve Voice Canada and World for inviting me to present today and share my perspective. So I'm a cardiac surgeon by training, initial training, here at the Ottawa Heart Institute in Canada, where I trained for open procedures to fix valves. I was sort of lucky and privileged in a sense to be sent to the States, two leading centers, high volume centers, as the first Canadian surgeon and train on how to fix valves through going through different arteries, so percutaneous approaches like TAVI, for example. And then I came back to Canada in 2017 in order to bring some of those skills and technologies back here. It paid dividends for my colleagues, the cardiologists, the surgeons, the administration here at the Heart Institute to invest in that extra training, because we grew the program together to be, to perform over 500 procedures, for example, in the last year and serve our patients in the local population, even abroad. So I think the importance for me of shared decision making is, as a surgeon, I can present to the patient the spectrum of different therapies that can be done, whether it's open or percutaneous, in sort of an unbiased way, and can guide them through the different and difficult decisions at times of which procedure to choose and the nuances of each procedure. And I think that has helped a lot for those patients to come in the day of the procedure, be fully informed, and have their 2 feet basically jump in, be ready for their procedure without any hesitation. And I think, as Christina mentioned, they're often happier knowing what their procedure entails, and in the recovery process, they're a lot more engaged because it doesn't just stop at the procedure, it continues afterwards. Thank you.
Yeah, thank you so much for that introduction, and also for getting us started in that broader discussion of shared decision making and why you, as a clinician, want to see that as part of a patient's journey. And I feel like you touched a little bit about why you think shared decision making is crucial in the treatment of heart valve disease. But I'm wondering, Talal, if you might be able to share any specific examples of where shared decision making significantly impacted a patient's treatment outcome.
So maybe I'll just start before that to say, 6 decades ago, we were just doing heart surgeries to fix valves. And only in the 2000s, we started having more options, more technologies. And as the safety profile of those new technologies improved, I would say only in the last decade, perhaps, now we're talking about strategies of treating patients, not just one different device or one different procedure. And I would say patients who are coming, in the gray zone of decision making, because there's still some black or white decision, perhaps that we could, guide the patient, but there's sort of a straightforward answer. But more and more, we're seeing that gray zone grow in terms of indications and what are the strategies. So we talk about lifetime management of a certain valve disease, and what different permutations are we going to do, whether it's heart surgery first and then a percutaneous approach. Sometimes it's 3 procedures in their lifetime. And I think, when it comes to patients, I would give, it's a sort of perhaps not specific, but patients between 60 and 70 years old that have a very long, perhaps survival, up to their 80s here in Canada. We have to think about the different permutations. So I'll give a few examples, a few patients that I've had, for example, 65 years old, who may be able to get an open heart procedure for their aortic stenosis, or they can have a TAVI procedure. At that point, you have a discussion of which one should we start with, because they may come back for a second and sometimes third procedure. And often it's the patient's context, their medical condition, their social environment, what they're going through, their journey dictates a little bit of which way we go. So I'll give an example of someone, for example, who's 65 years old, who is still working, cannot take time off work, is the bread earner for their family, is the caregiver for a significant other, and surgery may not be an option for that patient. Although, as a surgeon, we can do a safe and the procedure would probably go well, that may not be the right option for this patient. And the TAVI procedure is the way to go. I have other patients who will tell me, maybe perhaps a little younger, 60 years old, who could still go with either procedure, but do not want to see me again. And as much as they say we enjoy this consultation, I just want to have one procedure and never have another intervention in my lifetime. So then we talk about perhaps a surgical procedure with a mechanical valve, as someone a little bit younger. So the different types of valves have to be discussed as well, depending on what the patient is going through. And the third example I'll give, even someone younger, a 55-year-old patient who may have a cancer that needs to be treated very urgently in a surgical manner. And going through a surgical aortic valve replacement may not be an option there because it will delay their cancer treatment. So again, that factors in, and maybe TAVI, we don't often perform TAVIs in someone who's in their 50s of age. In this patient, that is the right choice for them because of the patient condition. So I think there are many different nuances and examples. And the one other thing I'll say is patients may come in and hear from other patients and families and friends of what they received, but I'll always remind them that their condition and their story is different and their anatomy is different. So it may not be the right option for them. Thank you.
Those are some really excellent examples. And I think you're really illustrating about how shared decision-making is about making the treatment journey unique and specific to each patient, what their needs are, what their goals are, and what they want their life to look like. And I think that's such an important piece. And you really did highlight again about how some of this is very new for the treatment of heart valve disease, particularly as the treatment options have expanded. So on that note, Cindy, I'm curious to know your thoughts. What are some of the best practices for integrating shared decision-making into routine clinical practice, knowing that this landscape has really changed? What kind of things do you do?
So when someone comes into the clinic for their first assessment, my first sentence to them is, why are you here? And what are your goals for this assessment? From the get-go, to ensure that they're part of this discussion and they feel comfortable enough to share their life experiences, their stories, because every patient that comes in with aortic stenosis has, as Dr. Al-Atassi mentioned, they all have different experiences, healthcare needs, and different either acute or chronic issues that can affect their decision now. And so when I hear about what their current knowledge is, then I'm able to address their questions and concerns and fill in the gaps at times when either they have misinformation or aren't aware of the seriousness of their condition. I spend a lot of time on education, not only on what aortic stenosis is, but the typical symptoms and what can happen, and also how to prevent injury while they're waiting for their valve replacement. We also talk about quality of life. So I typically, when a patient comes in, I say we have two buckets. The physical bucket, can we physically help you and replace your valve? Yes or no? And that's what all of the medical diagnostic testing is for. And the most important bucket is the quality of life bucket and the decision-making bucket. And so we talk about both of those areas together, so I get an understanding of what each person has important, and so that it sets the ground frame for when I speak to them for their next appointment on how to help them to make their final decision.
So it sounds like education is a really major part of the shared decision-making process. Talal, did you want to jump in on that?
Yes, education is important. I think, there was a slide that was great, kind of highlighting what a patient perhaps should be armed with in terms of questions, and they can think about it prior to the visit. But I think where perhaps the clinical team can come in place is to share some of the trade-offs, because every patient comes to me, even as a surgeon, no one wants to have heart surgery. I totally understand that. I don't want to have heart surgery. If I can get something done with a smaller cut and go through the artery or the groin, that is a preferable way. However, I think everything comes with a trade-off. And I think it's our role to explain what's the trade-off between having, let's say, a less invasive procedure now and what that means in the future. And as humans, I think we are often stuck sort of in the present. So I think it's important for us to also educate and highlight what this may look like in the future. And after having that discussion and fully understanding the implications of every decision, whether it's watchful waiting, medical treatment, or a TAVI, something percutaneous, or an open procedure, then I think the patient can be empowered to truly make that decision based on their needs and preferences.
No, and I think that really does also speak to the value of shared decision making. Not only does a patient have the opportunity to be empowered about their own health, but there might be some anxiety if they think it means them coming in and then just, make the decision. There you go. That's not what it is. You're really hand in hand with your care team. You're getting the education and the resources you need, and then you're coming to a collaborative decision armed with all that information. And I think that is really an important point so that it doesn't come off as too overwhelming. But on that subject of education, I do know there's many types of resources out there, some of which are coming from clinicians and care team, but also some of them are coming from online resources, which sometimes are great and sometimes they're not the most trustworthy. So, Talal, what resources do you recommend for patients to help them access reliable and accurate information about their condition?
I'll be honest. So I think Christina has shared some of the decision aid tools that have sort of been involved in some of those discussions and development of these decision aids, which can be helpful. The one thing I will be sort of perhaps saying a little bit of word of caution is that we have to continue to update these, and they're excellent, and I think these are great tools that could be used, and I think the references were there in the slides. But we have to continue to, as the procedures evolve and as the field evolves, we have to continue to update those in real time. I often am faced more of the opposite of patients coming in using resources perhaps that are not as good online, Googling, again, hearing from friends and family in a different context what they've received. And I would say sometimes referring physicians, perhaps planting a seed that this is the way to go, maybe not having as much experience in the intervention side of things. And so what we have to do on our end is somewhat deconstruct that first, and say, well, what do you understand, first of all, about your condition? What do you understand about the different treatment options? And then based on that answer, some of them, some patients come in very well read and they have used the correct resources, and it makes my job easier, that's for sure. But if they do come in with misinformation, then I'll have to start a little bit going back into the initial phases, explaining what the disease is, and then going over every procedure. It is, I would say, time consuming. It's well worth it for the patient to understand. I think we need more resources for sure as a healthcare system. And of course, we're talking to an audience of different healthcare systems, but I think we definitely need more resources. Our nurses are excellent in sort of prepping the patients in terms of education. So it makes the surgeon and the cardiologist saves a little bit of time, but I think it is important to still do that exercise and educate the patient and refer them to the resources that were mentioned earlier.
Absolutely. And Cindy, do you have any specific strategies that you'd recommend to help patients critically evaluate the information they find online? How do they decide what's trustworthy and what's not?
So the first assessment and visit they have in the clinic, I provide them a booklet. And so I do have 2 slides. So if we could put them up now. So the first slide, this is the cover of my TAVI booklet, and it guides them through the process from beginning to end. And so each patient is provided with this, and as well, there is a PDF and a digital resource they could use on sunnybrook.ca. So they each get this. And then on the next slide, when they come in for the discussion after they've had their diagnostic tests, and I review the results with them, including the incidental findings, so other findings that could impact their healthcare. This is the same kind of slide that Ontario Health has come out with, and I actually created this in 2020, so before Ontario Health created it, because I have found that with adult educational practices, it's so much easier to have a conversation with a visual. And this is 100 people. And what I do is based on each patient's risk profile for either surgery or TAVI or medical management, I can circle what their statistics would be specifically for them based on their treatment options. And it helps them to see visually what their risks may be with either procedure. And what I found is that this significantly helps the families and the patient when they're discussing what is best and what will improve their quality of life. They're able to visually see what kind of impact or pro and con can be, whether they replace their valve or choose not to. And it also opens up time for discussion for them to ask questions about each type of risk that they could be undertaking. And so I find this very helpful for every conversation. And they get a copy of this as well because it's within their booklet.
That's really great. Thank you. And then just to wrap it up, there's one more topic that I think is really important to talk about, which is that we know that some clinicians might resist engaging in shared decision making. This is somewhat new, and I want to get both of your thoughts on that. What are some of the reasons why they might resist, and what advice would you give to patients who are encountering that resistance with their healthcare providers when they're trying to engage in shared decision making? Maybe Talal, you could start us off.
Yeah, I think it's probably unique to every place, every center. I think we've touched upon sometimes time constraints, perhaps for the clinicians and the team, resource constraints, whether it's HR or other resources that can sometimes play a factor in perhaps not going in detail in terms of the education and explaining and having the time to do shared decision making. And it sort of turns it unconsciously into sort of a paternalistic and prescriptive model rather than a shared decision making. And then at times, I would say, and we authored a book on this, the heart teams, having a heart team in your center where things are discussed as a group. And I always call it the heart team. It's not the surgery team. It's not the TAVI team, because it is a multidisciplinary approach, and insisting that the discussion is being had with everyone on the table, not only the cardiologists and surgeons, but the nurses, the anesthesiologists, the radiologists, everyone is involved in that discussion. So I think some of it may be a little bit of development of those multidisciplinary teams in some places where it's a little bit behind in that, and other times it's just restriction of resources. And then lastly, I would say sometimes a little bit of bias. Again, I sort of have that privilege of coming in doing both procedures. So you're able to see both sides of the world and the nuances. But sometimes, I would say some people may be biased into one type of procedure because they do it every day and not as aware of the other side. And that's okay, as long as the other practitioners can weigh in on every single discussion.
Absolutely. And Sydney, if you wanted to finish us off, what advice would you give to patients who might encounter that resistance with their providers?
So I always encourage everyone to be clear on what is important for you for your quality of life. So to think about that before you come into the clinic. And it's even helpful to write it down so that when they're in the clinic, often when you're nervous, it's hard to remember your questions. And so if they have it written down, it's even more helpful. And I also encourage to inform your healthcare provider that you want to have that kind of discussion and ask questions. Show that you're curious and you want to know more and be engaged, and ask those questions. Especially with patients, I have several now who go to Dr. Google and then get a preconceived notion of what actually can happen and often isn't correct. And so I encourage them to actually tell me that and to actually ask me those questions so I can clarify. And then when they feel there's any kind of resistance, they can reach out to their own care providers who referred them to the clinic. So they can go back to their family physician, their cardiologist, to have some questions answered, who can also advocate on their behalf as well.
Joanna, may I
So
just add one? So this is a saying that I've heard recently, and it's the squeaky wheel that gets the grease. So really, voice your opinion, voice your thoughts, your questions, because that's how you're going to get answers, and that's how you're going to be empowered. So thank you.
Absolutely. No, that's perfect. It really is about finding someone who's willing and open to have that dialogue with you, answer your questions, and make sure you're on the same page so you're ready for what happens next. So first, I want to thank you both so much for sharing your perspectives and experiences with us. This has been hugely helpful for me, and I hope our audience to get that valuable insight into what shared decision-making looks like for clinicians. And I think it's a huge help for patients to understand it from your perspective. And with that, I'm really happy to turn to our two patient advocates so we can see what it looks like for them. So I'm going to call Bill and Cole up to the screen. And I'm going to, sorry, just one second. Bill, if you might be able to get us started by introducing yourself, that would be great.
Yes, Bill Power. I had a TAVI procedure in 23 3 years ago, I was 65 years old, on the cusp of open heart or going TAVI, but my decision-making process took me down the TAVI road, and quite happy with that.
That's really great. Thank you so much, Bill. And Cole, would you mind introducing yourself and maybe telling us why you wanted to talk about shared decision making today?
First off, thanks for having me on Global Heart Hub, and thank you also for putting this together, Joanna. So my name's Cole Warren Morrow. You can call me Cole. I currently work as a physician assistant in interventional radiology in Hamilton. I, 2 years ago, was diagnosed with aortic stenosis and regurgitation, as well as aortic root dilatation. And I went through the shared decision-making process with my cardiologist, my cardiovascular surgeon, to determine the most suitable treatment plan for my condition. And I thought it was a very empowering experience. My surgeon really laid everything out appropriately and really took the time to acknowledge a lot of my concerns with some options, and so I thought that experience, that empowering experience, really made a good impact in my care, and is one of the reasons why I'm here today speaking with you. I had a mechanical aortic valve replacement with aortic root repair with a Bernthal procedure. And yeah, doing well.
Thank you so much for that introduction. It sounds like you've been able to go through that process of shared decision making, and I'm really excited to dig into that a little bit more with both of you. So first, I'd like to just start out by hearing more about what shared decision making means to a patient. So Bill, would you might be able to tell me what shared decision making look like in practice for you?
Well, for me, I had a doctor retire and a new GP, fortunately, and found out I had a heart murmur, and I was referred to the Ottawa Heart Institute and met with the team through a series after the diagnostics. And there were several options, open heart or going with the TAVI procedure. And the information that was provided to me was crystal clear. It was, I knew the risks. I knew what the benefits were. And in my particular situation, because of my work situation, and that I was 65, so I'm right on that cusp of one or the other. They gave me I guess I call it some soak time. It wasn't like I didn't have to make the decision that day. And then the Ottawa Heart Institute website had all the videos and the instructional materials. So I guess I chose then not to go to Dr. Google and so I stayed with that information, and I met with the team several times, and I got the information I needed, and I felt very comfortable then going with the TAVI procedure, and knowing that there may be another intervention somewhere down the road. So I was prepared, and I accepted that, knowing that could well happen, given that the expectant performance of the valve that was put in may require a little bit of a tweak or a replacement. And as we know, the technology is evolving, so who knows, there'll be a better valve and give me a longer life. So I'm quite happy with the decision-making process that I was provided with, and I certainly think I made the right one.
So just to recap some of the things I'm hearing from you. Some of the key parts of the process for you was some time. So it wasn't on day one where a decision had to be made. You were able to sit with it and take in some of the information. You had multiple visits with your care team. So multiple times were you able to engage with them, ask questions, get more information. And then you also had access to the resources, the education, and the information that you needed to make a decision. And then lastly, they were honest with you about some of the risks, some of the pros and the cons. And so you were able to have all of the information you needed to make a decision. So it sounds like a really comprehensive process that you went through that helped make that decision for you. Does it sound about right?
Yes, it was a team approach right from the get-go, and every time I called, the phone was answered by a live person, so it was wonderful.
That does make a difference, and it feels, at least in other parts of the world, quite rare these days. Cole, if I could turn to you, I'm curious to know if there were any key moments in conversations you had with your healthcare providers that impacted your shared decision-making journey. Which ones may have stood out to you?
For me, I kind of had a bit of a unique experience because I had a pre-existing professional relationship with my cardiologist, and he introduced me to the cardiovascular surgeon almost like pretty much during my initial echocardiogram, which diagnosed my condition. So that my key moment, I think, would have been when I met with both my cardiologist and my cardiovascular surgeon to determine what the options were in my situation for management of my heart condition. And they both took the time to outline the different options, the nuances, the spectrum of options, and also kind of hear my concerns with certain options in terms of longevity, in terms of sort of the risks, and also kind of explaining my lifestyle. I thought that was a particularly important experience for me. Moving forward after that, I had a constant dialogue and kind of phone follow-ups with my cardiovascular surgeon, just to he would provide me reassurance, but also sort of additional resources. And because of my clinical background, I also kind of had an opportunity to seek my own clinical resources. But I think it's also worth mentioning that in this day and age, we have to be very particular with the resources that we choose and select, because with social media, I think that can be not a great place to get your resources, because it is kind of this mixing pot of different sort of I guess opinions that can be taken as actual fact, which in many cases it isn't. So it's why it's so important to have resources that are recommended to you by your clinicians and your care team, so that you're getting the right information and making the right decisions with that information.
Absolutely. So, sort of touching on that idea of education and having the right resources, and sometimes coming across misinformation and how that can impact things. Bill, do you have any experience with encountering misinformation about your condition or your options, and how might you have handled something like that?
Well, I didn't have a community to within my own work, or anybody that really has gone through this. So I had no, I guess, people in my circle that would be able to give me advice. So when I went to the Heart Institute and met with them, and I looked at the information on the website. Yeah, I did look at some other information sites, but I chose not to spend a lot of time dwelling on it, because that increases anxiety. And you if you say, all right, I know what I'm going to do, I've got the procedure, it's going to be set. So I stayed away from information that would just cause my wheels to turn and kind of make the heart. Wasn't fixed yet, so I didn't want it to be impacted that way.
Absolutely. Cole, you have an interesting background as both a patient advocate and somebody with experiences in clinical practice. And I'm curious to know your thoughts on what happens when a patient wants to engage in shared decision making, but they have some real fears or anxieties in making that final decision. What is your advice to somebody who's saying, I want to be part of this, I want to be empowered, but I also sometimes need either my doctor to take charge or some guidance at the end?
The first thing is making sure you have a very solid foundation for your resources, so that you can get the information that you need. And taking the time to bring those resources and your questions to your healthcare provider, I think is a very important thing to do as a patient. Oftentimes we all encounter, at least in my clinical practice, patients will say, "Oh, I had all these questions, I just forgot them all." And so if as you're preparing for your appointments with your clinicians, just to write questions down that you have, so that you're making sure that you're not missing any of the questions or concerns that you have, because you don't want to be in a situation where you're walking out the front door and you're wishing you had asked a really important question to you. So I think that's a really valuable thing to do.
Yep.
Yeah, that's great. Bill, do you have any thoughts on that about what it might be to engage in this process and then at the end still not know what you want to do and need some additional guidance from your care team?
Well, after my initial consult, it was I was headed for open heart surgery because the initial echo in that said it was bicuspid, but further analysis said, oh, it's tricuspid. So I was then it was an option to go with TAVI. So that opened up the conversation again. And on the second consult, then I was able to get my questions answered about the risks and the recovery time, and which was important to me. So but then that all that information kind of I had to consume that in small bits, because there is a lot of information that was given to me, and the care pamphlet that once I'm in the process, that was all really good, and what to do and be ready for it. And when I made my decision to go with the TAVI, I felt, yep, this is the right decision for me. I've got the information. I've talked to all the people, and the team were very open to pros and cons, and not trying to sway me one way or the other. Because again, at 65, you're right on the cusp of one or the other, because normally TAVI goes for the older folks that are older than 65. But in my case, I was eligible to go with that, and I went with it based on the information that was provided to me.
So I think maybe the key thing here is that emphasize the word shared in shared decision making. A patient is not on their own in making that final decision. They're hand in hand with their care team, and the care team is there to help them make that ultimate decision and figure out what their treatment journey will look like. And I think that really is key here. Cole, if I could come back to you, I'm wondering what your thoughts are, again, as both a patient and somebody in clinical practice, about if there's any times in your journey where a healthcare provider either supported or maybe resisted your involvement in treatment decisions, or maybe if you might have a different perspective of that in clinical practice, did you have more of a voice, whereas other patients maybe have less of a voice sometimes? What are your thoughts on that?
My situation kind of being unique, I did have the opportunity to have even more of an ongoing dialogue with my surgeon. I having had worked with them, we exchanged phone numbers, so there was an ongoing dialogue in my specific situation. But I know that's not going to be the case in everybody's situation. And so in dealing with, I guess, healthcare professionals or clinicians that may be resistant to hearing, I guess, or hearing concerns that you may have, I think it's just worth taking time, scheduling appointments, and meeting with them in person, just to really outline your concerns. Just continue. I just wanted to also echo what Dr. Alatasian said with nobody wants to be undergoing open heart surgery. That is not a very comfortable experience to be approaching. And so, but putting trust in your clinicians to make sure that you are getting the answers or the questions that you had answered will help you, I guess, deal with some of the anxieties you have around the procedure, but also acknowledging that it's not a great situation to be in, And so it's important to use the resources that you have and the relationships that you have with your clinicians to get you through the experience and healthy again.
Absolutely. Bill, would you have any tips or strategies that you would offer to other patients who are wanting to advocate for themselves and use their voices? What would you tell them?
I would tell them that you need to get the information after your first consult. You have to have an intervention done, and ask all the questions that come to mind about the recovery, what the procedure is going to be like, the day of surgery, and I think they need to be informed with wherever they're getting the procedure done. For me, it was the team approach at the Ottawa Heart Institute, and I didn't go beyond that to get information. So they answered all my questions, but I would suggest that they don't hesitate to ask and pick up the phone if you got there's no stupid questions. It's just the ones that you don't ask is the ones that you regret not asking. So I was very comfortable with the resources that I had at hand to answer all my questions. And anybody that's going into this procedure, they need to be aware of the beginning and the end process, the recovery time, and then what the follow-ups are going to be in the years coming, and how your health is going to get better, and make sure it stays better by following a good, healthy regime of diet and exercise.
Absolutely. So I'm definitely picking up some really important tips here, especially in terms of just write things down, come prepared, have things written down, because sometimes in the moment things can be very overwhelming. You can get a bit lost in, your appointment, and then the time flies right by and you feel like you haven't gotten to answer or the answers that you've needed. So maybe, write things down, bring somebody with you who can maybe record things or take notes for you, have some support in the room. I think that's really helpful. And then just the last question, Cole, for you. Are there any benefits of shared decision making that you'd be able to share? Some real benefits that you got out of the shared decision making journey?
Really just empowering the patient on making sure that they're reassured with the decision that they're making. Again, these any sort of procedure there are going to be uncertainties and anxiety associated with it. So at least if they can be sure that they're making the appropriate decision for them, that will provide them reassurance and confidence with going ahead with the procedure.
Well, that's great. I want to thank both of you for being on this panel. I really appreciate your time. I know how valuable it is to hear patient stories and patient voices and what a difference it makes to the global community. So thank you again so much for your time. We now have just a minute left, so I'm going to start wrapping things up. I want to thank all of our panelists who were here today for their time and their expertise. I know I got a lot out of this discussion, and I appreciate all of them being here. I also want to say how grateful I am to have been able to partner with Heart Valve Voice Canada and Ellen on this webinar. Ellen and the entire organization brings such a wealth of experience and expertise, and we're very grateful to them. Thank you as well to everyone in our audience. I hope this was valuable for you, and I appreciate you spending this time with Global Heart Hub and Heart Valve Voice Canada on this webinar. Last thing, you should see a survey for this webinar after exiting, which I do hope you'll take the time to fill out so we can always continue to improve. I'll also note that we will be sending out the recording of today's session as well as some additional resources to all attendees. So I hope that's valuable to you sometime in the next week. And for anyone interested in learning more about our work, I encourage you to reach out to us. Thank you again, and I hope to see you at our next webinar.